is that there are already tools in our toolbox. We have testing, the laboratory response network, the LRN, has multiple sites. It seems to be part of the reason why we're not getting as many people tested in the US as you said, the clinician recognition. But then we may also want additional tests developed. When you mentioned antivirals and vaccines, can you both talk a little bit about the vaccines and the antivirals available for this and how effective they are?
So, in terms of treatment, because this is a relatively mild disease, I think the most important thing is really supportive treatment to help prevent, itching and things that might lead to a secondary bacterial wound infection. And then, of course, isolation, so you can limit spread to other people. I think that the disease, basically is largely supportive management. However, there are two different drugs that are available. At least one of them, I think, is through an IND, an investigational new drug protocol. It's a drug called tecovirimat, which is it's FDA approved for smallpox. There's a few others. There's cidofovir, which is a treatment for CMV that we know from days in the past where we've used this for treating CMV retinitis. And there's also vaccinia immune globulin, which probably would help cross-protect against somebody with the disease. And there, in any case, I think that a lot of these are, other than maybe some animal studies, there's not a lot of human data using these agents. So if we had a more severe case or somebody who was very immunocompromised, that would be the scenario where it would be worth considering both the vaccinia immune globulin and potentially one of these drugs.
Yeah. And John, do you want to speak about the vaccines that are currently available as well?
Yeah, from one of the fortunate things about being able to respond to monkeypox is that our experience with smallpox has given us a lot of experience and a lot of tools. The smallpox vaccine, also called vaccinia, was used to eradicate smallpox around the world. And from circumstantial data that was gathered then, it's been recognized that that vaccine does protect against monkeypox in a significant number of cases. We still have that vaccine. We have derivatives of that vaccine that are known to be safer than the original smallpox vaccine, which did have a low level of side effects. And so the intervening years have been spent trying to make a vaccine that is just as good, but has fewer side effects. And so as David mentioned, there are now two separate vaccines that can be used in this context. And that's really very encouraging. If you think about it compared to SARS-CoV-2, to COVID-19, at the beginning of the outbreak, there really were no tools. At the beginning of, or perhaps in the middle of this monkeypox spread, there are a lot of tools that can be brought to bear. I agree with David that some of them are not as well tested as we would like, but they are in advanced development. There's a tremendous amount known about them, and they can be applied really quickly.
And can I add that it's really, the U.S., the Centers for Disease Control has been preparing for something like this. Although I think their concern is that there could be a smallpox outbreak. Even though smallpox has been eradicated, there's still a concern that somewhere someone might have it. And so therefore they have stockpiles of these medications and the vaccines in sort of special places across the United States that can be mobilized very quickly. So they really have a large amount of vaccine doses available in case there were a large outbreak. I don't think so far there really, it's been minimal use. I think some for some exposed healthcare workers, but again, if healthcare workers are using proper protective equipment, they should have zero risk of becoming infected.